And Jeremiah, this is kind of a weird moment for me because I'm legitimately really excited to get to talk to you. I feel like I hadn't seen you in ages. But at the same time, we're talking about kind of a depressing topic. So I'm going to try and balance that enthusiasm to get to talk to you with the seriousness of the topic we're getting into today. But for everybody else that's on the call, I got to meet Jeremiah years ago when I was working in New Mexico at the Earth Data Analysis Center. And Jeremiah would come down to our state and regional GIS working group, so the New Mexico equivalent of TNGIC, as well as some Southwestern state level meetings. And I got to meet Jeremiah there, and then we just kept getting to bump into each other in places like the ESRI User Conference and things like that. And I learned about the work that Jeremiah was doing with the opioid epidemic, but I had no idea how it was that Jeremiah got started on that, why it was that he decided this was going to be one of the things that he worked on. So I wanted to invite him in today to talk about that because so many folks within the department and within the university, this is a really big topic for them. So we're going to get to all that stuff. But Jeremiah, we do have some folks in here who are thinking about geospatial careers. And so I really wanted to start out talking about the fact that you actually have a bachelor's and a master's in geography. And I'm trying to figure out, because it's pretty rare to have young people come into university and decide that's something they want to do. So how did you decide that you wanted to get into that discipline?
Sure. Well, thanks again for having me and this great forum that you've been doing. Yeah, so how I got started, I think I was in early college. I was undeclared, not quite sure what to do. I was playing around in the engineering department, and I just didn't really quite feel like the path I wanted to do. So I was doing some exploring and visiting some other professors, and one in the geography department had talked about GIS. He said, "Why don't you just come in, visit the lab and watch one of the classes?" And I watched one, and then it kind of took off from there. So that's kind of where GIS was living, is within the geography departments, and I got really excited about GIS pretty early on, and it just kind of took off from there.
And then you decided to stick around the same program, and then you moved on and got not only your bachelor's there, but also your master's in geography. So a lot of the folks in these conversations, when we have them, are thinking about pursuing a master's degree. How was it you decided that's the route you wanted to go before moving into the job market?
Yeah, I suppose when I got done with my bachelor's, I was just kind of looking around, and at the time, it was 20 years ago, GIS was really just starting to swell, and I felt like there was a lot more opportunity, so the master's seemed really appealing. I was looking at some other schools, but it was another professor there that had a project that said, "Well, do you want to get working on this early?" And kind of continued on. It ended up being my thesis. I think Adam was talking about forestry, but it was actually related to that. There was a big event in the Rocky Mountains where basically the jet stream dipped down and hit the Rocky Mountains and turned backwards and blew down 25,000 acres of trees. So it was really a study on that to kind of see, like, why did the trees blow down where they did? You had a big patch of trees that were blown down right next to trees that weren't. So it was just kind of an interesting study and a forestry application, and it was a kind of a project that was queued up, and I was like, I liked Wyoming at the time, so it was appealing to stick around.
And so one of the other things I talk about with students when we're thinking about grad school is we talk about funding. Was this something that they had funding for you while you were there?
Yeah. I'll admit that was part of the sway to stay there. Is there was a stipend to help pay for things, and I was kind of already rooted there a little bit, so yeah, that did help.
Nice. All right. And then so you got your bachelor's, you got your master's, both in Wyoming, and then you stuck around afterwards too, right?
Actually, I was offered a job with ESRI pretty much right away, but I within like a couple months I was there, but I had I was working kind of during my graduate time at a part-time job with an organization called YGIST. So it didn't stick around too much longer after that.
All right. Well, this is actually pretty cool because Jeremiah's with ESRI, Nick is with ESRI as well. So I'm kind of excited to get to put you guys together. Well, let's come back to this because I want to talk about this more, especially with Derek. a little bit later. But let's go ahead and switch then into the work that you've been doing with ESRI. I'm going to hit screen share, and I'm gonna bring this map up that you spent a lot of time on, and this is how I got to know some of the work that you were working on. So, Jeremiah, one of the things I think I tend to be guilty of when I think about geospatial technology, and we think about things like public health and epidemiology, is we tend to get really excited about data sets, and we think a lot about, you know, how we use those data and how we make decisions and help, you know, policymakers and decision makers use that data effectively. And one of the things I think we have to be really careful of in this space is realizing that these are not just numbers, that these are actual people, and there's the real consequences, and there's sometimes, depending on the data set we're looking at, there's some real suffering that goes with this. And so what I wanted to start with first was this celebrating lost loved ones. And can you tell us a little bit about how this got started and why you decided to build this tool?
Yeah, so maybe just click that explore map and just kind of look at this, a little bit more context, or yeah, if you go to that one, it'd be great. Basically, the story behind all this is every dot on this map, as you zoom in and zoom out, the clusters, you know, kind of change. But every person on this map has a story, and if you click on the dot or click on a picture, you can see the stories behind these people. So yeah, you can just take any one of those, and in the upper right there's add lost loved ones. So these are all added by family members. So this is you can see that, you know, either a father or mom had added their son Justin, and some people get really, you know, carried away and, you know, having a very long tribute. Some people keep it kind of short and sweet. There's over a few thousand people on this map that I get started. If you go out to Wyoming, that's kind of where my story kicks in, and that it was about a dozen years ago that unfortunately I lost my little brother. So he's the very first person on the map, JT. So he passed away, and it was several years before I even talked about it. It's not something you're really comfortable, you know, going and saying, yeah, I lost my little brother to a drug overdose. But this is kind of really a personal passion for me. And as this map grew with a few thousand people and a few thousand families that were started talking, the National Safety Council was kind enough to kind of take this on and, you know, kind of help promote it and give it a home. But yeah, that's the whole idea, is to, you know, really take something behind the numbers and share stories. I think the combination of stories, and now that there's a few thousand people and there's someone in every state, people can see that this is in their backyard. I mean, the whole idea was to break stigma. There's a lot of stigma around this topic about, you know, drug junkies, you know, just living in alleys, and it's really not what this whole topic is about. Is, you know, there's people all over being impacted by the opiate epidemic, and that was really kind of the purpose for this map.
So how did you get into this relationship with the National Safety Council?
So they were doing a campaign around opioids, and they wanted stories. So they started pestering me about, can we talk to the parents of any of these people? And I had a lot of emails, you know, that people were contacting me. And it kind of got to be, well, you know, I wasn't just giving information out. I kind of wanted to check with people, and a lot of the parents were willing to talk about it, but it got to be, at the same time, a little bit overwhelming for me just to kind of manage and keep up. And so I was like, well, if you're really interested in this, would you be interested in just, you know, running with it? And they were kind enough. Unfortunately, a couple of my key contacts there were just let go due to COVID and funding the National Safety Council. So we'll have to see what, you know, kind of the next steps of this map is moving forward.
So let me pause here. Charlene, or Katie, or Liam, the folks in particular that are working on opioid stuff, any questions for Jeremiah or feedback for Jeremiah at this point?
I think it's very interesting. Jeremy, I work in the criminal division, and prior to the forming of our nonprofit, worked with our victims. So I've been that voice that's been on the other side of those family stories. And I know they have such a need to share their stories. So I'm excited to learn more and learn how we can connect some people in our own community who can be able to tell their story. And then I also work with our 9th Judicial Drug Task Force and our Tennessee Bureau of Investigation. And we want to be able to map hotspots of where overdoses are occurring in our district.
Yeah, sure. So that's another big part of kind of what I've been doing is just around the further opiate mapping for sure. But yeah, happy to kind of make the connections and talk more about sharing that map and stories.
Good deal.
And I'm putting links in the chat. So if you see those little notices come up, the first two there are from the National Safety Council, as well as the map, a link to the map that Jeremiah made. And then Katie and Liam, if you have anything else, please chime in, because I know where I'm going with Jeremiah next.
Okay. I really love this map that you've created. We're working on this specifically for the state of Tennessee, and our intern, when he was in Liam's class, created something with information that the state was providing with stories, and this really is another source that adds more to that. And so I'm going to share that with our recently named director of substance misuse at the system level. And now I'm wishing I had thought about having her join us today. But I think it's a great, because we're doing a new policy network around substance misuse, being a science kind of advisory for the state legislators. And obviously stories are extremely important part of that. And so I am going to share that, and hopefully we can incorporate it in some way.
Sure, great.
Well, based on what Charlene said, Jeremiah, do you mind if we move into this opioid mapping initiative open data portal? So let me pull this up, and then like you kind of walk us through some of the tools that you're developing to help communities and help stakeholders. And if you would prefer to actually share your screen and work through it, just let me know and I'll make that switch.
Okay, cool. Yeah, so just a little bit more background on the history. You know, I guess I started seeing things on the news so much, I got to a point where I felt like I should do something. I started here in Colorado. I started getting data from the health departments and just asking them for overdose. And I made some time animated maps of how things had changed in Colorado. And that's kind of how the Celebrating Lost Loved Ones map got started. Is I met some other parents that wanted to share the story. So that's kind of how the idea got started. But then I really wanted to also do things with the real data that I was, doing things like mapping the actual hotspots and overdoses. So I started, there were counties that were doing this, and I kind of just started to search and look for people that were doing this and find them. And I was just kind of making a collection of examples of what people were doing. All the while, there was someone that I'd met just kind of in parallel to my ESRI work. Her name was Denise Ross, and she worked with the Obama administration, and she had helped start the police data initiative. It's much of like what you're hearing now in the police. Is several years ago, there was maybe a little bit more quiet drive for police departments to get data out, like use of force and things like that. So one of the things they had done in the White House is to work with cities to try and get data out for police. So she really kind of encouraged me to, take on this little fellowship out of a nonprofit through DC that I kind of did with that she was with at the time, that kind of do something much like what she did, get together a bunch of communities and share their stories. So that was the idea of the Opioid Mapping Initiative. So yeah, maybe if you scroll down just a little bit, what the initiative was is still kind of going on, but there was really it was about a year and a half of monthly phone calls where I would basically, just like what we're doing now, you're having the fireside chats, we would have calls with cities and counties where they would share what they were doing. So Northern Kentucky Health Department is one of the third ones there. Actually, if you click on that, that might be a news article or something. But I just tried to take as many reference cases as I could, and just talks about like what they were doing. Northern Kentucky was, I think they were a hotspot early on when it came to this topic, but they were doing a lot of work in this. I think in some ways they had probably the most comprehensive data catalog. They had overdoses, they have arrests, they have things like hepatitis C mapped out to see, on a county or zip code basis to see where these trends are. And hepatitis C was also, important because people are sharing needles and things like that. So yeah, they had this story map that basically walks through this whole data set. So every month I would just basically say, hey, Northern Kentucky, would you share, basically be the guest presenter? And they would do that. And we had, by the time it got to be done, we had, well over 20 organizations that were sharing. Some of them are health departments, some of them were police departments, all sharing a variety of things. It was really surprising. When you think about GIS, you think, okay, well, what am I going to map when it comes to overdoses or the opioid? There's overdoses, but there's a lot more. Just as I was mentioning in Northern Kentucky. And then there's the things like help resources. For a while, the big thing was, where's prescription drug drop boxes? If you scroll up just a little bit there, one of them that we highlight there was naloxone. So communities were mapping, where can I go get naloxone? Naloxone is a prescription drug that will reverse an overdose. So if someone had an overdose, it's either a nasal spray or an injection that you can basically revive. EMTs, medical technicians carry this with them, but it got to be such a problem that people were really encouraging, just everyone to have it. That just through my connections, I had it in my backpack that I would travel around with too, just in case you see a case. So this map was really for families that would have loved ones to say, where could I go and get it? Oftentimes they're lost. So it started because a lot of the participants were already starting to do this. So we just decided, like, can we make a national data set out of this? And then some of the pharmacies such as Walmart and Walgreens gave their data to this as well, and it just kind of grew. So that's really the opioid mapping initiative was to kind of compile some data sets, but really just to get initiative of these communities starting to share stories. I think the unfortunate thing that I actually just got an email from Northern Kentucky this morning is a lot of these great people were, they're in the health domain and they've just been so sideswiped by COVID that they haven't had much time to work on this topic much this year. But it's a big problem still. So I think it's something that's being revisited a bit. So I'll kind of pause there.
Yeah, let me hit the stop share button again real quick. And let me toss it back over to Charlene. Is there anything in there that you wanted to get some more information from Jeremiah about?
Questions are very, very basic, like how do we begin to even enter the data? We have lots and lots of data. Our nonprofit was formed out of our district attorney general's office. So we have loads of data there. We are the fiscal agent for a prevention coalition in one county with 2 counties in the wings that will soon hopefully be funded. We have great relationships with all of our law enforcement, and I sit on the 16 county East Tennessee Health Council. So there's loads and loads of data floating out there. I just don't know how to lasso that data, lasso that data and then get it to where it can be streamlined in some sort of easy to understand format.
Sure. Yeah, there's so many different data sets that are out there. I guess it probably depends on like what are you most interested in. I think overdoses are probably the most telling. In some ways, a lot of times you see a heat map, and the heat maps are just maps where population are. But if you break it down a little bit, there's been some popular methods for like hex bins and things like that to see that the overdoses always don't equate just to like where the populations are. That there are things that can stick out on the maps. So I think it's just taking the data and getting it on the map, and then we can start to take it the next steps of like, well, how do we visualize that? And I can happy to kind of dive into more of a side conversation anytime with you on that too. The other thing I think that's been really important is just changes over time. How is it progressing? The hotspot 2 years ago may not be the hotspot today.
Right.
Yeah. Do you have it's overdose specific data? Have you seen much?
Well, through the district attorney's office, every time there is an overdose in our 4 counties, our medical examiner is required to send that information to our office. But it's just there in a very fragmented notebooks of autopsy reports, not any way that you could visualize who's coming from what county, how, I'm sure we can pull data that says how many have died of a drug overdose, but I'm not aware of like a go-to spot to get that information. So what we hope to do is create something that the community can go to and find resources for. On the flip side of that, law enforcement would love to be able to use that same kind of information to find out where these drugs are coming from, because in Tennessee, we can charge a person with second-degree murder if we can identify the person that gave them the drugs that they overdosed from. So twofold. One, as a community resource for the community, and then a totally different way of looking at things from building stronger prosecution.
Sure. Yeah, so there's probably a few things to talk about there. As far as getting the data in, we can probably talk about like automating that, or like how do we keep that up to date. If you're getting it just on a one-off basis, we've seen people have a forum where you're just entering that in, or different ways to kind of keep that updated. So we can, I'm happy to kind of have those conversations with you. A couple of things that kind of come up too, just talking about overdoses that have been, I think the things that we've learned from the opioid mapping initiative and other people that have used it is, if it's an overdose, breaking it based upon the drug type has been important too. So, there's prescriptions which you can overdose from. Then there's been a progression of heroin to fentanyl to carfentanil. And what a few counties have seen is if there's overdoses in prescriptions, it's going to be a year or two later, there's going to be overdoses in the street narcotics. So it can almost be an indicator there. So I think that's an important way to kind of look at what's ahead of time. From a law enforcement side of thing too, it's also important to have not just the drug type, but where the overdose occurred and where the person's home address is. So it's true that like actual overdoses might be in like a downtown area if someone goes out and they're working there, or they're they go out and they have social functions there. but their home address where they came from might actually be the suburbs. So it's kind of a different telling of like where an overdose occurs versus where that person physically lives too. So I think there's some interesting trends there.
Right.
So yeah, there's just under that concept of, you know, one mapping overdoses. There's a lot of things to think about there as well. And there's one other thing I was going to mention. It's escaping me at the moment.
As Charlene was talking, all I could think was it sounds like she needs an intern to do a bunch of data entry, unfortunately.
Well, Raquel is Raquel is my attempt at that. She is working as an AmeriCorps Vista, so she gets a living stipend, but not a lot of pay. She can also have another job, so keep that in mind, Michael.
I don't have any funds either.
Yeah, we're happy to have another conversation. It's been popular for people to just have like a form entry where they're entering in this information. If you're getting it kind of in a disparate format too.
I guess I could start by pulling our files for the last year that has the autopsy report in there and any notes that we have. And I guess starting that as just our initial columns that we would create for data entry.
Mm-hmm.
And do you recommend we do that on Excel or?
Yeah, Excel is pretty flexible to any format
Okay.
for a spreadsheet. Yeah. You know, this is kind of a whole nother topic that's interesting in this is that I've learned along the way is it's not an exact science for an overdose death. County coroners who record the deaths do it differently all over.
Mm-hmm.
You know, there's some counties here in Colorado. There's a county down south where the coroner kind of has a stance that most overdoses are going to be logged as suicides. So there can be that case where there might be suicides, and you know, there's been parents that get, you know, pretty frustrated because they didn't think it was a suicide, and that's all up for debate. But a lot of times there's going to be medical examiner notes that go along with it. You know, if there was, you know, drug paraphernalia around, then, you know, that is a suspicion too. A lot of times there's going to be blood work that's done, and that blood work will determine whether it was an overdose or not. But sometimes it might be like right at that, you know, just below, but there's still a presence of opioids in the system. So there's like Oakland County, Michigan was one of the participants, and what they were doing is going through those records, and they're saying, I can't remember the cause, but it was an opiate likely contribution or something. You know, they'd have known overdoses, but then they'd also have cases that were, you know, maybe not, they didn't hit that toxicity level within opiates, but they, you know, there was maybe a strong presence there. So yeah, it's definitely not exact science of, you know, what's an overdoses.
Okay.
And that really all leads to, you know, there's a lot of people that really believe that the numbers that you see are actually quite underreported for this problem.
We have that very similar problem in our district. We have 4 counties and we have 2 different medical examiners. Well, one of our medical examiners in one of the counties almost always says natural causes regardless.
Yeah.
So I feel that our overdose deaths are drastically underreported. If we could streamline the data so that he can, by comparison, see, okay, in my neighboring county, the medical examiner is reporting, given the same information, the blood work and the notes, and we reflect things like, yes, the blood work was less than toxic, yet still present. He can still call it whatever he wants to, but we could create we would have enough data to decide
Sure.
that could maybe mark it as an overdose, whether he wants to call it an overdose or not.
Yeah, correct. Yeah, so that's one thing that you could do. And I guess I think it kind of came to me. The other thing I was going to really mention is kind of what you're doing. I think it's good to have just build a bunch of different partnerships of the different data streams. So it's not just overdoses that will help talk about this, but use public safety. So law enforcement arrests are kind of an indicator. You know, they might do that different from city to city. But a real strong one is going to be working with your EMTs or typically your fire departments. They are logging where they have gone and distributed naloxone. Many cases, the fire departments are finding value in mapping that because public's perception is, it's a bunch of, people in the fire department hanging around, eating snacks and, responding to one fire a week. In reality, 95% of their calls are medical calls, and that the number of overdoses have really taken off, especially the last few years. So they see value in kind of showing how their job has changed. So if you can work with local EMTs or fire departments, you have overdoses, but you're also having like what they're responding to as well, beyond just the deaths.
Yeah, and I know that through our prevention coalition, which is part of a statewide and then a national, there are records of everywhere that naloxone is distributed in our counties. So I probably need to find out exactly who the source is on that, or you all, Katie, you may know if there's someone else like Tennessee Department of Mental Health and Substance Abuse that funds a coalition. Are they keeping records somewhere?
So what I learned from a recovery court funded group was that they submit the data, as well as like we learned from our other interns research, as well as like all the local law enforcement agencies submit the data directly into the Department of Health and Mental Science, mental health at the state level system.
Right.
So
Which
many of them don't end up using the data because it's going just directly into their system, and so they don't have the resources to then take it and then use it for their own operations, which and so that we're still just trying to figure out where it is. There isn't a current place where that is actually Judge Sloan, who's on the steering committee.
Okay, I know Judge Sloan.
Yeah, so that's his ideal situation, is that we have one big massive data hub for this.
Now, I'm just gonna kind of drill it down the way that I think about it in my own head. But if you look at the whole continuum of healthcare and you divide it into sections, prevention is a section, treatment is a section, recovery is a section. So all of those areas are funded through different buckets of money and have different databases. So in our recovery court in Morgan County and Roane County, all of that data is entered into a program called 10 WITS that goes to the state. Then we have coalitions like the Prevention Alliance of Loudoun County, where I'm sitting right now. Their whole focus is on basically awareness and education as it relates to alcohol, tobacco, and substance abuse. It's that bucket that is funded to distribute naloxone and Narcan and the things that are prevention measures. So they enter everything into a database as well. And it still goes to the state, the Tennessee Department of Mental Health and Substance Abuse, but I don't know that those two departments talk back and forth to each other. And then in the next section where you've got treatment, we have West Care Tennessee and Ridgeview Behavioral Health and Hiwassee Mental Health and Helen Ross McNabb, who are all receiving state and federal funding to provide assistance with substance abuse and mental health issues. And they are required, as a condition of their funding, to report those numbers back through, I think they call it a GPRA program, and I can't remember what GPRA stands for, GPRA. So I know all three of those different areas are gathering data, but I don't know that any one person knows what the left hand or the right hand is doing.
So let me bring this back to Jeremiah then. So Jeremiah, since you're working with a lot of different stakeholders and a lot of different communities all across the US, do you have any communities that you found where all these different parts are doing a good job of communicating that we could almost use as a best practice or something like that to guide what we're trying to develop here?
Yeah, I think some of them I have listed. So where I live, Tri-County Health has a consortium. The Northern Kentucky folks were a good one too, where they've really gone out and have a partnership to get a lot of these different data streams from different places. And that's honestly, it's a challenge. You know, the data can be sensitive. You know, there's concerns around HIPAA and other things. So it's a challenge, but if you can get over those, then then you can start to bring a lot of those data sets together. So yeah, there's some of the folks I was on the mapping initiative, they really just had their one domain of knowledge, and maybe it was in the police department, but there's a few of them that were able to bring together several different data streams together like that.
So do you have a contact person in Colorado and a contact person in Kentucky that heads up that consortium?
Sure, yeah.
Because basically that's the same philosophy that we had when we developed Align 9, because we were founded by public defender, district attorney, faith-based community, and healthcare providers. So we take all of those and try to work together to solve whatever problems we have.
Yeah, it is a challenge. I think in the cases that I have, they were driven from county health departments. I think a lot of times the county health departments have the most data to start with, and maybe just have them being official department, then they were able to kind of corral and get some of the other pieces. So the contacts I'd share with you are probably epidemiologists that's kind of helping do some of that corralling. Yeah, there's other places. Thinking bigger level at the state of Colorado, there's a bigger task force, and within that task force, there's subgroups. Like there's the data committee. So there's folks that are trying to get all that data, and I think it's more the broader you get, moving out to the state, it becomes even more challenging.
Right. All
right, let's see. So Jeremiah, it is 4:16 Eastern time, and I asked you for 45 minutes of your afternoon, and we have hit it. I'm happy to stay on for a few more minutes. If you want to stay on for a few more minutes, we'd love to have you, but we also want to be respectful of your time.
Yeah, I can definitely go for another 15 for sure. So yeah.
All right. So here's how I think we should think about going forward. It sounds like Jeremiah and Charlene's team, and maybe even Katie's team, maybe need to follow up with each other and have some more conversations where you can really get into the weeds and think about logistics for your specific examples and the specific challenges you're going to be facing. Because it sounds like Jeremiah can bring a lot to the conversation to help you think about what questions you can answer, what problems you can start working on, some of the data models to think about. And it sounds like Katie can help you think more about who some of the other partners might be. And Katie also has a background in GIS, so she can also think about this not only from a policy standpoint, but also from a technical standpoint as well. So Jeremiah, if you don't mind, while we've got Derek here, I kind of want to switch gears, if this is okay, and talk a little bit about your experience at University of Wyoming, because unfortunately, University of Wyoming was one of the geography departments that closed. And since that's one of the areas that Derek had a lot of interest in as AAG president, I kind of wanted to open it up for the two of you in case there was anything about that you wanted to share with us about that. And maybe if Derek had any questions to you because of your relationship with the department.
Sure. Yeah. So that was really sad to see the geography department go. So one of the things I mentioned earlier was there's a department called it's kind of overgone a couple changes, but it was YOGO for a long time. But they're a department that is staffed by a lot of folks that are tied to the university. So there's some professors and so forth, and some other folks that are just doing more, consulting. So they get projects and they do a lot of, statewide work. So I'm still in contact with a lot of them, and some of them, to be honest, were people that got me started in GIS at the university a long time ago. So it was really sad to see, the geography departments go away by the wayside. So fortunately, they just announced, I think a couple months ago, that there's a GIS specific program that has come up, so at least, some of the ties of having geography are there, and some of those people that were, tied, closely to geography are kind of carrying on through that.
No, Jeremiah, thanks for sharing that. I mean, it's something that actually came up during my term as the AAG president. And unfortunately, what AAG found was that by the time we really learned of the full ramifications of the, in effect, closure of the geography department in a formal sense, it was sort of too little too late. The horse was already out of the barn. There wasn't a whole lot we could do, no matter how many letters we wrote, how many, I called people personally, myself on the phone. Decisions had already been made. I mean, and so I also sort of feel bad and grieve about that along with you. And I'm sure you feel it, especially given your roots to that program. And certainly keeping GIS alive is a great way to keep a lot of geography alive, but it's not quite the same, I don't think. That's at least my view. Now, if you don't mind me asking, Jeremiah, and I don't, suggest you should be an expert or know all the ins and outs, but one of the things that I think a lot of people in the AAG wondered, without getting into the business of naming names and digging up dead bodies and reburying them, what do you think was sort of the root cause of the closure of that geography program? Because I think it's an important lesson that a lot of us need to learn from.
It's a good question. I don't know if I have an answer for sure. I can only maybe just theorize a bit of, kind of stepping back. I think even, facing some of the challenges about like when I graduated with a geography degree, people are like, oh, are you going to go to, teach high school geography? I'm like, well, I could. That's very important, but it's much bigger than that. So, I mean, I think there's that challenge. So, I think people, maybe to you have that perception. So, having a stronger link to what is there. I think about right now on my job at ESRI. I mean, we're extremely busy. We're getting tons of requests with all these world problems. And it's all related back to the stuff that is in geography. So you think about, these hurricanes that are coming through and, physical geography and like all the subject matter you learn there, all the, the racial and all these other bad topics that are happening, the things that you learn in human geography. I mean, everything's like really playing out right now, and it's busy in GIS, but I don't think, people lose that connection. And I think maybe that's just one of the things that maybe just have to be, more important is bringing that connection back. And, maybe I think it's kind of a reverse. People get really excited about GIS and, okay, there's a GIS degree. But the most successful people that like the customers that I work with in cities and counties, they're not just successful because they're like, oh, I'm going around and I'm a GIS expert. they're going around to serve their city and find the people in the departments, the mayor's department or the public works director, and seeing what their problems are. So I think it's really just kind of equating, yeah, GIS is cool, but we really have to figure like what are the problems that we're solving with first. And maybe that's just where some of this flip of like, well, we have GIS degrees instead of geography is we kind of lost that parallel of, well, there's problems. That's how geography was founded. We're looking at those from a geographic context, but maybe we just need to do a better job of applying and, disseminating that information. I don't know if I'm making any sense.
No, I think that's very well put, Jeremiah. I really think it is. And it gets at not just sheer marketing. There's always room for better marketing, but it's about changing the way the public sees and understands geography, which is really, I give a lot of credit to Michael Campanovo. And you guys should know it hurts my body to give Mike Campanovo any credit. I mean, I think I'm probably going to have to be hospitalized after I say this. But that's exactly the point of Mike joining our department and the fantastic work he's done. Liam Tran, who I see on the screen, Q Shang Wu the same way, and Nathan McKinney. These are guys really in there pitching the ball really hard to show the problem-solving capacity of geography. Sometimes I wonder why people don't get it, but they sometimes don't get it. And this is what leads sometimes to programs. So anyway, I just want to say thanks for addressing that. I know it's a difficult issue, but I think we've got to talk about these difficult issues if we're going to conquer them.
Yeah, agree.
If you want to think more about this, do you know Adam Carno with ESRI?
Mm-hmm. Yep.
Okay, so Adam's got some really interesting thoughts, I think, on reframing how we communicate and how we talk about GIS. And maybe we are actually doing ourselves a big disservice by talking about how we do GIS. And instead, maybe we need to think about how we rephrase that as using the power of location to solve problems and answer questions. He's got a number of times he's been interviewed on podcasts. He's got some great links up on LinkedIn, and he's got some stuff on YouTube. And he's actually going to be our keynote at our TNGIC meeting, the virtual fall forum we're going to have. So anyway, he's just got a great message, I think, on how we reframe that. And I think maybe it lines up with what both Jeremiah and Dr. Alderman are talking about in terms of shifting that conversation.
Cool. Yeah, Adam's great.
We got one other person on the call. Morgan is on here with us. So for Morgan's benefit, I'm going to ask a little bit about your role with getting in with ESRI and what you see for our students who are thinking about that as a career path. So Nick obviously has got the internship this summer, and he's hoping that transitions into something full-time. So you've been with ESRI, I'm not going to say exactly how many years, but a number of years. You've seen a lot of changes in the industry. You've seen a lot of changes within the company itself and how it's grown over time. For young people who are interested in looking at ESRI as a potential career later on, what sorts of things are you looking for with those students? What are some ways that they can really help stand out when they come in for interviews and submit resumes and that sort of stuff?
Yeah, I've been with ESRI quite a while. It's been almost 20 years, so it has been a while. I'm kind of my third mini career within it. It's grown, and I think that's a benefit to incoming folks. We've definitely have been hiring quite a few. I would just say think about what you want to do and what it is, how you want to apply. I will almost to a counter of what I said a little bit ago. If you really are a Python person and that's what you want to do all day, then there are roles for that, and there's definitely careers for that. At the same time, there's broader things to do too, for kind of applying the problem as well. So as far as thinking about when you want to get into ESRI, I would just say look at the careers page and see what's out there and go from there. The internships are a great place to kind of get a feeler for sure. So just think about what you want to do and think about kind of longer term and maybe how to apply yourself. There's a lot of different roles, from engaging with customers to being more development and documentation to more consulting. So there's a lot of different kind of ways to apply.
and just in case you're curious, I'm pretty sure that those internship postings for the summer actually typically get posted in like September. So there's a long lead time on those. I suspect you probably get thousands, if not tens of thousands of applications. So do keep an eye on getting those in early. And then Jeremiah, do you ever get to work with the student assistantship program at the UC over the summer?
A little bit. I know I kind of meet people. I know a couple of people who work directly with them. So I've met several of the students at the time, but not directly.
Okay.
Yeah.
I think you have to. I think the applications for those are usually maybe start back in February. I think maybe.
They are all pretty early for sure. Yeah.
Yeah. So if you're looking for opportunities with ESRI, you got to really think long term and get out in front of these things, because it's not like you can start applying in May and see what comes up. Jeremiah, we're very quickly approaching that extra 15 minutes that you graciously gave us. So let me find if there's anybody else that has any last questions for Jeremiah before we let him go back to his day.
I do have one question, Jeremiah. We are having an overdose awareness event on August 31st. And so if we were to encounter a family that would want to share their story on your site, if I could just have like a 1, 2, 3, these are the steps you would take, what can I pass on to them to get them connected with you?
Yeah, the website's out there. We can reshare it with you, but it's pretty simple. Go to the website. There's a big blue button that says Add Lost Loved One, and they fill out a form, and then it gets approved by NSC, and I help them do that. But yeah, it's pretty simple. Yeah.
So go to the website, Add Lost Loved One, complete the form. That's pretty simple. All righty, thanks.
Yeah, I just pulled it up here, and it looks like there's about 8 or so questions on there. Yeah, that's pretty simple, and you don't have to have a fancy account with anything. You can just log in as a guest and that sort of thing. So Jeremiah and his team have made that very, very easy for folks to use.
Okay, and can you tell me what ESRI stands for?
Yeah, so a long time people used to call us ESRI, but we kept on correcting them to say it's Environmental Systems Research Institute, which is the full mouthful. And it was really about kind of doing some environmental consulting is how it got started. But then I think as we grew, we gave up and said it's ESRI.
I like it.
All right, Jeremiah, thank you so much for spending your afternoon with us, sharing your personal story with the opioid epidemic, and then most importantly, sharing with us the ways that you're helping communities change the narrative on the epidemic and make a difference in their own community. So thank you so much.
Thank you so much for having me. Yeah, happy to chat with any more of you. Yeah, it's great. Thanks.
Thank you. Thank you.
Thank you.
You might